Hello friends, welcome to the Fundamental Pharmacy. Today again I have come up with a new video for you, and the name title of video is nothing but the drug of choice for different poisoning and disease. It is very important video as far as pharma competitive exams are concerned. Okay, so exams like your GPAT 2021, Niper, then your drug inspector, government pharmacist, and other pharmacocompetitive exams. Friends, this video is going to be very important, useful, and knowledge oriented for you. So it's my request. Please watch complete video. Friends, in this session we will learn different type of poisoning or intoxication, their symptoms, and drug of choice along with their mechanism. So guys, without wasting time, I would like to start the session, and if you think it's very good and useful to you, then please like, share, comment, and please subscribe the channel and press the bell icon so that you will get a notification of recent videos. Okay, so let's start. Important drug of choice. So before discussing actual drug of choice, you should know what is mean by drug of choice. So first of all, you should know what is the exact meaning of drug of choice. Okay, so drug of choice, it is nothing but the best choice of medicament or drug, amongst the available options. Okay, so if you are suffering from particular disease, so drug of choice means number of drugs used in one disease only. For example, in anxiolytic or CNS depressant, for example, in case of sedatives, you have a lot of drugs, but the best choice of medicaments among the available for a particular disease or for a particular condition, that is known as a drug of choice. Okay, so best choice of medicament among the available option for a particular disorder. For example, you might have read somewhere or in the books that DIGIBIND is a drug of choice for the treatment of status epilepticus. Okay, you might have read this. Okay, but you know diazepam is a benzodiazepine derivative. So in that benzodiazepines you have a number of drugs. Okay, amongst all the benzodiazepines, diazepam is a drug of choice for the treatment of status epilepticus. Why? It is the best choice of medicament amongst the available option. Okay, so you might have got clear about the drug of choice, the term drug of choice. Okay, so it is the best choice of medicament among the available options. Okay, now we will see poisoning. So what is meant by poisoning? So it is a symptoms and signs that appears after the consumption of overdose of your drugs, that is known as a poisoning. Consumption of overdose of your drugs, consumption of various chemicals, consumption of various poisonous gases, or consumption of anything that will uh, create problems to human body, or that will leads to intoxication and death, that is known as a poisoning. Okay, so every drug is a poison if taken beyond the dose of therapeutic value. Every drug is nothing but it is a poison itself. Okay, if you take beyond the therapeutic value or beyond the prescribed limit, so if you take any drug beyond the prescribed limit, that is going to be poison you. So it is a poison. Okay, so poisoning is nothing but the signs and symptoms that developed after the overconsumption of your drugs, chemicals, or plant product, or any gases, or any chemicals that will harm your body and leads to death. Okay, so that is nothing but the poisoning. Okay, so why there is a poisoning, you must understand it. So poisoning may be because of the following reasons. Poisoning may be because of the following intent. Okay, so what are the intent? So poisoning may be accidental. So suppose that you consume overdose of drug accidentally, that comes under the, if you are very much interested, if you like mushroom curry, sometimes what happens, because of improper condition or cultivation, that mushroom gets poisonous. Okay, so there develops a poison in the mushroom. So you might have heard or you might have read in the newspaper that there is a mushroom poisoning due to eating mushroom curry. So that is a accidental. You have not you have got this accidentally. Okay, you got poisoning accidentally. So that is a accidental poisoning. So second poisoning may be consume poison intentionally, for the suicide purpose. Suppose that you are depressed, and in the depression you consume lot of drugs, or overdose of drugs, or you consume a poison. So that comes under the suicidal poisoning. Okay, so third one is a homicidal. Homicidal means if anybody has given overdose to you intentionally. If anybody has given overdose of drug or overdose of gases to you, and his intent, his purpose is killing you or to murder you, then this type of poisoning is known as a homicidal. Okay, so if anybody has given overdose of drug to you, or uh, for the killing or murder purpose, then it is a homicidal. Okay, so poisoning may be because of three reasons: accidental, suicidal, and homicidal. Okay, so I think you hope you have got clear area about the poisoning. Next one is, now we will see the individual poisoning and their drug of choice. Okay, so paracetamol poisoning. What is the drug of choice in the paracetamol poisoning? So N-acetyl cysteine or methionine. N-acetyl cysteine, or second option is methionine. It is these are the drug of choice in the paracetamol poisoning. Okay, so first choice is your N-acetyl cysteine, and if it is not available, then methionine. Okay, so you must know paracetamol is a very safe drug. It is a pretty safe drug, but their poisoning occurs. Then why there is a poisoning of paracetamol? Why it occurs? Okay, so if you take overdose of paracetamol, so paracetamol itself does not cause any symptoms, any intoxic symptoms. Paracetamol itself does not cause any intoxication symptoms. What happens actually, when you are on a treatment of paracetamol, the paracetamol is metabolized in your body. That is known as a detoxification process. Okay, so paracetamol is a metabolized. Oh, okay. After metabolism, it is converted into one metabolite. It is converted into one metabolite that is known as N-acetyl parabenzoquinone imine. Okay, N-acetyl parabenzoquinone imine. This is a metabolite. Okay, after metabolism of paracetamol, this paracetamol is converted into N-acetyl parabenzoquinone imine, and this is very toxic metabolite. Okay, it is very toxic metabolite. It is extremely toxic metabolite. It is extremely toxic metabolite to the liver, which, see, this metabolite binds covalently with the proteins and nucleic acids of liver cells. Okay, this metabolite N-acetyl parabenzoquinone imine that binds to the proteins and nucleic acid of cells and damage the cells. Okay, so this metabolite that is known as N-acetyl parabenzoquinone imine. Okay, this is rapidly detoxified in the body by glutathione. This toxic metabolite is rapidly detoxified in the body by glutathione. But what happens in the paracetamol poisoning? There is a depletion of glutathione. There is a decreased level of glutathione. There is a depletion of glutathione, and which leads to liver injury. Okay, so the toxicity of paracetamol is because of its toxic metabolite N-acetyl parabenzoquinone imine. Okay, so a lot of times they have asked the question on this: what is the drug of choice in paracetamol poisoning? That is a N-acetyl cysteine. Okay, and paracetamol is hepatotoxic because of what? So it is because of its metabolite, that is a N-acetyl para-hydroxybenzoquinone imine. Okay, next one is, what is the toxic dose of your paracetamol? Okay, so 7 to 15 gram. If you consume 7 to 15 gram of paracetamol in a day, that is nothing but the toxic dose. Okay, so what are the symptoms of toxicity? Okay, what are the symptoms of toxicity, or what is the symptom of poisoning? So you will have symptoms that occurs in the three phases: phase first, phase second, and phase third. Okay, phase first usually appears in the 24 hours of after consumption. Okay, so 24 hours of after consumption of paracetamol, the first phase toxic signs and symptoms appears. So what are those signs and symptoms? These are nothing but the initially you will have nausea, vomiting, abdominal discomfort. So in phase first, toxic symptoms, you will have these symptoms: nausea, vomiting, and abdominal discomfort. In phase second, there is a sign of early liver injury. Okay, there is sign of early liver injury in the phase second. So there is a little bit liver injury, early sign of liver injury. You will have a pain in the upper quadrant of your liver. You will have pain in upper quadrant of your thoracic cavity. Okay, then there will be acute renal failure. There will be acute kidney failure. There will be acute renal failure. Okay, this occurs in the phase second. Okay, after one days, after 1 day, and after 1 to 5 days, you will have phase 3 symptoms. These are nothing but the severe liver necrosis, means inflammation of liver cell. Okay, so severe liver necrosis, liver failure, multiple organ failure, and death. Okay, so paracetamol poisoning, I think it might be, you might clear about paracetamol poisoning. Each and everything I have explained in this slide. Okay, so we will see next slide. In the next slide, we will see atropine poisoning. Okay, so atropine poisoning. So drug of choice for atropine poisoning is nothing but the physostigmine. Okay, so physostigmine. You will get this information anywhere in the message, WhatsApp message, or etc. etc. But nobody is going to explain you this. Okay, so please watch this video until end. Okay, so atropine poisoning. Second one is atropine poisoning. The drug of choice used is physostigmine. So you know, atropine is nothing but your parasympatholitic drug. Okay, parasympatholitic, it is an anti-muscarinic agent. Okay, so you can easily predict what will be the probable symptoms of toxicity. You can easily predict. So what will be the symptoms of atropine poisoning? So initially you will have dryness of mouth, difficulty in swallowing, then hyperpyrexia. Okay, so dryness of mouth, because of it is a inhibitor of your glands. Okay, so it will inhibit your secretion. So dryness of mouth, difficulty in swallowing, hyperpyrexia because of inhibited sweating. Okay, you will get a hyperpyrexia. Then blurred vision. Why? Because it is a mydriatic encephalopathy. Okay, so that's why you will have blurred vision. Then blurred vision, then mydriasis and paralysis and coma. So these are the symptoms of atropine poisoning. So why it happens? Because of accidental consumption of your datura leaves, accidental consumption of your belladonna leaves, or maybe we have already explained the poisoning because of 3 reasons. That is, first is accidental, second one is a suicidal, third one is a homicidal. Okay, so amongst these 3, any one might be a reason for poisoning. Okay, then why physostigmine is used in the atropine poisoning? Why it is a drug of choice for the treatment of atropine poisoning? You should know this. See, physostigmine is a irreversible anticholinesterase. Okay, which increases the level of acetylcholine. That means what? See, physostigmine is a irreversible anticholinesterase. Anticholinesterase means what? It will inhibit the cholinesterase enzyme. Okay, so it will inhibit the cholinesterase enzyme. So what will happen after inhibition of this cholinesterase enzyme? So after inhibition of this cholinesterase enzyme, so you must know what is the role of your cholinesterase enzyme. So cholinesterase, what it will do? It will metabolize acetylcholine. It will break down, it will cause hydrolysis of acetylcholine into acetic acid and choline. Okay, so your acetylcholine will not be available. See, atropine is a muscarinic blocker. Okay, so it is having antagonistic action to the acetylcholine. Okay, so if you increase the level of acetylcholine, automatically atropine will not bind to the receptor, and your poisoning will be in a control. So that's why physostigmine is given. So physostigmine, what will do? Physostigmine will bind to this anticholinesterase and inhibit it. And once it is inhibited, so it will not metabolize the acetylcholine. So acetylcholine level will increase. So once acetylcholine level will increase, then it will act on its receptor, and it is a competitive agonist and antagonist. So it is a competition. There will be a competition in between atropine and your acetylcholine for the receptors. Okay, so atropine poisoning will be controlled. So that's why physostigmine is used in the atropine poisoning. Remember this. Okay, Again, this was the question already. A lot of times they have been asked in the GPAT Niper drug inspector pharmacist, etc, etc. So it is very important. Okay, then we will see next benzodiazepine poisoning. Okay, so benzodiazepines are nothing but the sedative, hypnotics, anti-anxiety. Even they are also used as an anesthetic agent. Okay, so basically they are seen as depressant drugs. Okay, so after poisoning you will have symptoms of depression, seen as depression. What will happen after seen as depression? So those are nothing but the symptoms of benzodiazepine poisoning. Okay, so in case of benzodiazepine poisoning, what is the drug of choice? So drug of choice in benzodiazepine poisoning is a flumazenil. Okay, so flumazenil is a drug of choice, remember. So what are the symptoms of benzodiazepine poisoning? So as I have told you, it is a seen as depressant drug. So you will have a sedation, drowsiness. What is meant by sedation? It will induce sleep, that is known as sedation. Drowsiness means you will feel to asleep, आपको नींद आने का होगा, that is known as a drowsiness. Then it will cause ataxia. So symptoms of benzodiazepine poisoning: sedation, drowsiness, ataxia, and slurred speech. Now I will explain this term ataxia. So most of the student doesn't know what is ataxia. So actually ataxia is nothing but there is a incoordination between muscle. There is a total muscular incoordination, and there is a problem of balancing. So if anybody is suffering from ataxia, the patient will not be able to control him or himself. So he cannot stand, he cannot walk, he cannot do coordinated activities. Okay, again there will be slurred speech will not be clear. Okay, that is a slurred speech. So why flumazenil is used in benzodiazepine poisoning? See, flumazenil is a complete benzodiazepine receptor antagonist. Okay, so it will antagonist the benzodiazepine receptor. And you know what are the mechanism of benzodiazepine? What is the mechanism? So they will act on the benzodiazepine receptor, that is GABA, alpha subunit of GABA receptor. Okay, that is known as a benzodiazepine receptor. So flumazenil will antagonist, it is an antagonist. Okay, so benzodiazepine is an agonist and flumazenil is an antagonist. So it is a specific benzodiazepine receptor antagonist. So that's why flumazenil is used in the benzodiazepine poisoning. So it will reverse all the symptoms. Next one is cyanide poisoning. This is very important, and they have asked a lot of times question on this cyanide poisoning. Even they have already asked the question on benzodiazepine poisoning. Okay, so it is very much important. This cyanide poisoning is very important for GPAT, Niper, as well as your pharmacist exam and government lectureship, etc. Other pharma competitive exams. Okay, what is cyanide poisoning? So cyanide is a having cyano group. Okay, C and C triple. So cyanide, it is a nerve gas. You must know the background of it. Cyanide is a nerve gas, and during Second World War, the Hitler used to poison the soldier of his enemy. Soldier from enemy squad by using this cyanide poisoning. Okay, by cyanide. Okay, so in case of cyanide poisoning, drug of choice is your amyl nitrate or nitrate. Okay, so drug of choice is amyl nitrate. So we will see what happens in the cyanide poisoning. Okay, so cyanide has a pretty good affinity for the heavy metals, so it will bind to the ferric ion. Okay, so cyanide binds and inhibits the mitochondrial cytochrome A3 oxidase. So it binds to the cytochrome oxidase and inhibit it. Okay, and once you inhibit cytochrome oxidase, then your cellular respiration will be inhibited. So cellular respiration will be inhibited, and your cell will not be able to utilize the oxygen. Okay, so cyanide binds and inhibit the mitochondrial cytochrome A3 oxidase and inhibit the cellular respiration and aerobic utilization of oxygen in the cell. Ultimately, what happens if your cell is not able to utilize the oxygen? Then the cell will have accumulation of toxic product and cell will die. Okay, so this cyanide first affect on the brain. Okay, so because brain is a highly oxygenated tissue, highly perfused tissue. Okay, so it will affect on your brain. So nitrite, okay, so nitrite, amyl nitrite, sodium nitrite, these drugs are the used in the cyanide poisoning. So amyl nitrite is a drug of choice in, and second, sodium nitrite is also used. Okay, so amyl nitrite is a drug of choice. So what will this nitrite do? So nitrite will convert hemoglobin to methohemoglobin. Okay, nitrite will convert hemoglobin to methohemoglobin. Okay, and as I already told you, this cyanide will bind to the ferric ion of hemoglobin, and it will, there will be a complex of cytochrome oxidase and cyano complex. There will be formation of complex of cytochrome and cyano complex. Okay, so nitrates, what will the nitrate do? Nitrates will convert hemoglobin to methemoglobin. Nitrates will convert hemoglobin to methemoglobin, and now this methemoglobin will combine with your cytochrome and cyanide complex. This methemoglobin will combine with cytochrome oxidase and cytochrome oxidase cyanide complex, and now this because of this methemoglobin, your cytochrome cyanide complex, which is irreversible because of binding of cyanide, now it will dissociate, it will be dissociated. So okay, so cytochrome oxidase cyanide complex form cyanomethoglobin. Okay, and there will be free of cytochrome oxidase, so there will be cytochrome oxidase will be free. Okay, so there will be this discharge of or displacement of this cytochrome oxidase from that cyanide complex. Okay, now this cytochrome oxidase is available for cellular respiration. Okay, that's how amyl nitrate and other nitrates act. Along with nitrates, sodium thiosulfate is also given. Okay, so sodium thiosulfate, what will lead to cyanomethoglobin. Cyanomethoglobin will combine with thiosulfate and it will form thiocyanate. Okay, it will form a thiocyanate. Now this thiocyanate is easily excreted from the body. Okay, it is easily excreted from the body, it is a complex. Okay, so it is easily excreted, complex containing cyanide. Now you will have sulfate and methemoglobin again. Okay, so nitrate will convert hemoglobin to methemoglobin, and sequentially thiosulfate will help cyanomethoglobin will convert it into thiocyanate, and that thiocyanate containing cyanide group will be excreted from the body. So you will have sulfate and methemoglobin. Okay, so your cyanide will not be able to inhibit your enzyme, that is cytochrome oxidase, because of these nitrites and thiocyanates. Okay, so that's why amyl nitrate is a drug of choice in the cyanide poisoning. Okay, then again, in case of cyanide poisoning, nitrates are used, then sodium thiosulfate is used along with your sodium nitrite. Okay, so cyanide poisoning treatment kit is available, and now cyanide poisoning treatment kit is available now. It consists of amyl nitrate, sodium nitrate, and sodium thiosulfate. Okay, so it was the cyanide poisoning. It is a very famous, and it is very you can say it is one of the it is one of the favorite questions of examiner. Okay, it is one of the favorite question of examiner. If I would be an examiner, I will ask the question on this. Okay, so cyanide poisoning, so you must be clear about the cyanide poisoning. If you want to read more on this, you can read from reference books. Okay, this is a amyl nitrate, drug of choice is amyl nitrate in case of cyanide poisoning. Next one is a severe digitalis toxicity. Severe digitalis toxicity, so you know that digitalis is used as a cardiotonic, and it is used in the treatment of congestive cardiac failure. Okay, so the drug of choice is DIGIBIND. Okay, drug of choice is a DIGIBIND. Okay, so what are the symptoms of toxicity of digitalis? So you will have nausea, vomiting, diarrhea. As digitalis is a cardiac depressant, you will have bradycardia, cardiac arrhythmia, visual disturbances. Okay, so DIGIBIND is used to treat the digitalis toxicity. So DIGIBIND is a drug of choice in the severe digitalis toxicity. So DIGIBIND is also known as digoxin fab. Okay, DIGIBIND is also known as digoxin fab, and it will form a complex. What will it do? It will form a complex with digoxin. Okay, so it will form a complex with digoxin or digoxin, and now once a complex is formed, digoxin will not be able to bind to the cardiac tissue. Okay, So digibind is also known as digoxin PAP, and it forms a complex with digoxin and prevents the binding of digoxin to the cardiac tissue. That's it. How it is, how it's act. So severe digitalis toxicity, drug of choice is digibind. Okay. Now next 6, acute bronchial asthma. So what is bronchial asthma? Bronchial asthma means there is a narrowing of your bronchus due to external factors. There are a lot of factors responsible for it. So there is a acute narrowing. There is a decreased airway, that is known as airway reduction. Okay. So you will have a decreased lumen of your bronchus. Okay. So that is known as asthma, acute bronchial asthma. So drug of choice is salbutamol. So salbutamol is nothing but the alpha 2 agonist. It will dilate your bronchial muscle. Okay. So what are the reasons for acute bronchial asthma? So after vigorous exercise, some foods, if you got allergic to the some food, it will also create asthma. Then weather, particularly the cold weather, it is in the case of cold weather, it is more vulnerable for acute asthma. Okay. Then infection, emotions, drugs and few allergens. Okay, even some drugs and allergen can induce asthma. Okay, so these are the reason for asthma. So what is the drug of choice? It is nothing but the salbutamol. Okay, along with salbutamol, other drugs are also used. For example, corticosteroids. Corticosteroids. So inhalation corticosteroids, example beclomethasone dipropionate, then budesonide, and a few anti-allergic drugs like ipratropium bromide. They are also used in the treatment of bronchial asthma. But the drug of choice is nothing but salbutamol. Okay, remember this. Now, acute hyperkalemia. So, in case of acute hyperkalemia, calcium gluconate is used as a drug of choice. Okay, so I will explain. So, first of all, I will explain hyperkalemia. What is hyperkalemia? So, if you divide this term, hyper means extra. Kalemia means it is a potassium concentration. Okay, so if there is a increased potassium concentration extracellularly, if there is a increased potassium concentration extracellularly, that is known as a hyperkalemia. Okay, so hyperkalemia is the condition where there is an increase in the extracellular potassium levels, see, which leads to cardiac abnormalities. You know that which leads to cardiac abnormalities, conduction abnormalities, then cardiac arrhythmia, muscle weakness and paralysis. Okay, so you know that the role of potassium, it is an intracellular electrolyte and sodium is an extracellular electrolyte. Okay, so if potassium level is increased extracellularly, then it is known as a hyperkalemia. Okay, then why there will be abnormalities in the cardiac tissue like conduction abnormalities, cardiac arrhythmia, muscle weakness? Why it will be there? Because there will be no availability of sodium and potassium for exchange. Okay, so there will be less exchange of sodium and potassium, and that's why there will be conduction abnormalities, because it is a intracellular electrolyte. Okay, so in this case calcium gluconate is used as a drug of choice. So what will calcium gluconate do? Calcium gluconate is given because of its antagonizing membrane effect. Okay, calcium gluconate is a drug of choice in the acute hyperkalemia. It is given because it's antagonizing membrane effect of potassium and calcium. Okay, so it will antagonize membrane for entry of calcium and potassium. So it will push all the extracellular potassium into the cell. Okay, so driving extracellular potassium inside the cell, and that will remove the extra potassium present in the extracellular. So that's why calcium gluconate is used in the acute hyperkalemia. Calcium gluconate is a drug of choice in acute hyperkalemia. Okay, next one is cheese reaction. What is the drug of choice in the cheese reaction? So it is a phentolamine. So you must know what is the cheese reaction. I will explain. So cheese reaction, it is also known as a hypertensive crisis. Okay, so those patients who are on the treatment of MAO inhibitors, that is monoamino oxidase inhibitor drugs. Okay, so those patients who are on the treatment of MAO inhibitors, and if they take foods like cheese, red wine, beer, then banana or any milk product. Okay, such foods consist of one amine known as a tyramine. Okay, these food consist of amine, that is known as tyramine, that is present in these foods. Okay, so now what exactly the reaction happens, why there is a such hypertensive cases, I will explain. So suppose that any patient is on monoamine oxidase inhibitor. That means what? The monoamine oxidase enzyme will be inhibited, okay, in his body. Okay, so what is the role of monoamine oxidase? So it is a it metabolizes the amines, it metabolizes the monoamines. Okay, it metabolizes the catecholamines like your norepinephrine, epinephrine, then your adrenaline, noradrenaline, your other catecholamines like your dopamine, then your 5-hydroxytryptamine. So it is metabolizing enzyme that metabolizes the monoamines like your noradrenaline, dopamine, then your 5-hydroxytryptamine, histamine. So it is metabolizing enzyme of these amines, biogenic amines. Okay, so biogenic amines are metabolized by this MAO. There is one enzyme also, see, called as COMT, carboxy orthomethyl transferase enzyme. Okay, so COMT, COMT, that is beyond the scope of this video. So if you are giving MAO inhibitors, the MAO will not be available to metabolize the biogenic amines, and even this tyramine also metabolized by MAO. Now what happens? So the level of your biogenic amines will increase, your tyramine, your dopamine level will be increased, your noradrenaline level will be increased, and this tyramine is also present in the product. So what will this tyramine do? This tyramine will go into the synaptic clips of the nerve. It will go on the synaptic clips and it will displace, or it will deplete large amount of noradrenaline from the synaptic vesicles. So you have a large amount of circulating noradrenaline. So what will it do? So then it will act on different receptors, and it will increase blood pressure. So you will have hypertension. So that is known as a cheese reaction. So if any patient is on the MAO inhibitors, he or she is not advised to take these foods, that is food containing cheese, red wine, beer, banana, or milk containing foods, because of this cheese reaction. Okay, is that clear to you? And drug of choice is phentolamine. Okay, so phentolamine is a drug of choice in cheese reaction. Okay, is that clear? Next one is acute gout. So in case of acute gout, non-steroidal anti-inflammatory drugs, NSAIDs. Okay, in case of gout, non-steroidal anti-inflammatory drugs are used. Okay, what is gout? So in case of gout, there is a deposition of sodium urate. In case of gout, there is a deposition of sodium urate crystals in the joints, and the urate sodium deposition of these crystals will cause pain and inflammation in the joints. There will be a swelling. So that is condition known as acute gout. Okay, in that condition, non-steroidal anti-inflammatory drugs, are the drug of choice. For example, phenylbutazone, and then your indomethacin, then your coxibs, then your diclofenac, aceclofenac. All these drugs are used as a drug of choice in acute gout. Okay, so these drugs, non-steroidal anti-inflammatory drugs, they are contraindicated in the renal insufficiency or renal failure or peptic ulcer. So these drugs are contraindicated. What happens in the acute gout? There is a deposition of sodium urate crystals in the joints, and which causes inflammation, pain, and swelling. Okay, so there are other drugs also that are used in the gout. That is nothing but the colchicine, then steroids, etc. Okay, so colchicine, if you are using colchicine, you will have a side effect of bone marrow suppression and diarrhea. Okay, in case of steroid, prednisolone, betamethasone, and dexamethasone, they are frequently used. Okay, so these were 9 drug of choice, 9 condition and their drug of choice. Hope you have liked it, and thank you for watching this video. And I would like to say, we have published these books, Fundamentals of GPAT and Cracker Achiever. These are very much demanded in the market, and this Fundamentals of GPAT consist of unique tabulated chapter wise and notes and MCQs. Okay, this Cracker Achiever is consist of my famous question banks, that is Cracker and Achiever, from which there has to be as it is question in every year. Okay, so in 2018, 19 and 20 there was a questions on an average 28. Okay, so you can expect question in exam. So if anybody is interested, they can contact me on these numbers. So my WhatsApp number is given here, 9766654377. You can call me on, or you can WhatsApp me. I will explain the procedure. Okay, thank you very much for watching this video until end. Thank you, bye bye, and hope you have liked it and you have got something new. Your concept has been clear. Okay, thank you very much, bye bye, take care.